Canadians have already made use of these resources. Over 6 million free consultations and sessions. I encourage you to take good care of your mental health, as we all should do, and to reach out to those who are experiencing difficulty.
As we all know, the COVID-19 pandemic continues to have a profound effect on the mental health of many across Canada. If you or someone you know is struggling with mental health issues, resources are available. The Wellness Together Canada portal gives everyone across our country access to a wide range of free services online, by phone, or by text messaging in multiple languages. We also recently launched PocketWell, a free companion app to Wellness Together Canada that is now available freely for download. You can use this application to complete self-assessments, track your mood and mental well-being, and get access to resources and supports 24/7. 2 million Canadians have already used that support, with a total of almost 6 million free and confidential sessions. I encourage all of us to take care of our mental health and reach out to those that may be struggling. As we all know, the best tool to our fight against COVID-19 continues to be vaccination. So far, 82% of all Canadians of all ages have taken this important step and are now fully vaccinated. 48% have now received their booster dose, and close to 53% of children aged 5 to 11 have received their first dose. If you have not already done so, I urge you to make an appointment online or visit a vaccination clinic in your community as soon as possible. There are vaccines for everyone. It is a simple but very important way to protect ourselves, our kids, and our local healthcare services. Comme on sait très bien,
as we know very well, the best tool in our fight against COVID-19 remains vaccination. To date, 84% of all eligible Canadians of all age groups have now taken this important step and are now fully vaccinated. 46% have received a booster dose, and over 53% of children aged 5 to 11 have received their first dose. If you have not already done so, I urge you to make an appointment online or to visit a vaccination clinic in your community as soon as possible. Vaccination is a simple but extremely vital way to protect yourself, your kids, and your local healthcare services. In conclusion, even if it seems as though the worst of Omicron is now behind us, we must all continue to exercise prudence, and we must all continue to respect public health advice.
Although the worst of Omicron may be behind us, we all want to continue to exercise prudence and to follow public health advice. Thank you, merci, and doctors, over to you.
Merci, Minister Duclos, and bonjour à toutes et à tous.
Good day, everyone.
Although daily reported cases remain at record high levels and continue to underestimate the true number of infections, multiple indicators suggest infections have peaked at the national level, including daily case counts, test positivity, the RT or effective reduction number, and wastewater surveillance trends. As of January the 26th, the 7-day average case count of over 19,000 cases reported daily is a 28% decrease compared to the previous week, and incidence is declining across all age groups. As well, although the latest 7-day average of lab test positivity remained high at 19%, it has been gradually decreasing in recent weeks, including by 14% compared to the previous week. This reassures us that individual efforts, including the layering of personal protections like masking and limiting in-person contacts, together with population-based public health measures to reduce contact rates, are helping to slow transmission and mitigate severe illness trends. Presently, Lagging indicators are still rising. Over the same period, an average of close to 10,800 people with COVID-19 are being treated in our hospitals each day, including over 1,200 in intensive care units, and 168 deaths were reported daily. This is why it continues to be important to limit spread as much as possible. Getting up to date with the best available protection for COVID-19 vaccines substantially lowers the risk of severe illness. For those eligible, getting an mRNA booster has been shown to provide additional protection against infection, but most importantly results in very good protection against severe illness, resulting in hospitalization from Omicron. Health authorities in Canada have continued to monitor vaccine safety data from millions of COVID-19 vaccinations and regularly update vaccine recommendations. This week, Canada's National Advisory Committee on Immunization, or NACI, updated guidance on mRNA vaccination for children aged 5 to 11 years on Tuesday, and for adolescents aged 12 to 17 years today. Children and adolescents remain at low risk of severe outcomes compared to older individuals. However, the substantially higher rates of Omicron infection have resulted in greater number of children with COVID-19 requiring hospitalizations than previously. Hence, NACI's latest advice underscores important opportunities for enhancing protection in these age groups, specifically for those without contraindication to the vaccines. NACI now strongly recommends that children aged 5 to 11 years receive a complete 2-dose primary series of the Pfizer 10 microgram pediatric mRNA COVID-19 vaccine with at least 8 weeks between the first and second dose. NACI is also recommending a 3rd dose for moderately to severely immunocompromised children in this age group. For adolescents aged 12 to 17 years, NACI continues to strongly recommend a complete primary series of mRNA COVID-19 vaccines, including a 3rd dose for those who are moderately to severely immunocompromised. In addition, for adolescents who are at high risk due to biological and/or social risk factors, NACI now recommends a booster dose of an authorized mRNA COVID-19 vaccine may be offered at least 6 months after the completion of a primary COVID-19 vaccine series. These include adolescents aged 12 to 17 years who have an underlying medical condition that may put them at high risk of severe illness due to COVID-19, including those who are immunocompromised and who have already received a 3-dose primary series. Those who are residents of congregate living settings, including shelters, group homes, quarters for migrant workers, correctional facilities, or those belonging to racialized or marginalized communities disproportionately affected by COVID-19. Up-to-date vaccination is recommended for better protection in all eligible people. This is particularly important for parents, guardians, and close contacts in order to help protect children and adolescents who can't be vaccinated or have conditions that place them at risk for severe outcomes. However, as no vaccine is 100% effective, it is important for everyone to continue to use personal protective measures, such as wearing a good quality, snug-fitting mask, avoiding crowding, and improving ventilation in indoor spaces. Thank you. Merci. Megwidge.
Good day, everyone. Although daily reported cases remain at record high levels and continue to underestimate the true number of infections, multiple indicators suggest infections have peaked at the national level, including daily case counts, test positivity, RT, which is the effective reproduction number, and wastewater surveillance trends. As of January 26th, the 7-day average case count was over 19,000 cases reported daily, and this is a 28% decrease compared to the previous week and incidence is declining across all age groups. As well, although the latest 7-day average of lab test positivity remains high at 19%, it has been gradually decreasing in recent weeks, including by 14% compared to the previous week. This reassures us that individual efforts, including layering our personal protections like masking and limiting in-person contacts, together with population-based public health measures to reduce contact rates, are helping to slow transmission and mitigate severe illness trends. Presently, lagging indicators are still rising. Over the same period, an average of close to 10,800 people with COVID-19 were being treated in our hospitals each day, including over 1,200 in ICUs, and 168 deaths were reported daily. This is why it continues to be important to limit spread as much as possible. Getting up to date with the best available protection from COVID-19 vaccines substantially lowers the risk of severe illness. For those eligible, getting an mRNA booster has been shown to provide additional protection against infection, but most importantly, it results in very good protection against severe illness resulting in hospitalization from the Omicron variant. Health authorities in Canada have continued to monitor vaccine safety data from millions of COVID-19 vaccinations. And they regularly update vaccine recommendations. This week, NACI, Canada's National Advisory Committee on Immunization, updated guidance on mRNA vaccination for children aged 5 to 11 years on Tuesday, and for adolescents aged 12 to 17 years today. Children and adolescents remain at low risk of severe outcomes compared to older individuals. However, the substantially higher rates of Omicron have resulted in greater numbers of children with COVID-19 requiring hospitalization than previously. Hence, NACI's latest advice underscores important opportunities for enhancing protection in those age groups, specifically for those without contraindications to the vaccines. NACI now strongly recommends that children aged 5 to 11 years receive a complete 2-dose primary series of the Pfizer 10 microgram pediatric mRNA COVID-19 vaccine with at least 8 weeks between the first and second dose. NACI is also recommending a third dose for moderately to severely immunocompromised children in this age group. For adolescents aged 12 to 17 years, NACI continues to strongly recommend a complete primary series of mRNA COVID-19 vaccines, including a third dose for those who are moderately to severely immunocompromised. In addition, for adolescents who are at high risk due to biological and/or social risk factors, NACI now recommends that a booster dose of an authorized mRNA COVID-19 vaccine may be offered at least 6 months after the completion of a primary COVID-19 vaccine series. This includes adolescents aged 12 to 17 who either have an underlying medical condition that may put them at high risk of severe illness due to COVID-19, including those who are immunocompromised and who have already received a 3-dose primary series, or those who are residents of congregate living settings, including shelters, group homes, quarters for migrant workers, correctional facilities, or finally, those who belong to racialized or marginalized communities because those are disproportionately affected by COVID-19. Up-to-date vaccination is recommended for better protection in all eligible people. This is particularly important for parents, guardians, and close contacts in order to help protect children and adolescents who cannot be vaccinated or who have conditions that place them at risk for severe outcomes. However, as no vaccine is 100% effective, it is important for everyone to continue using personal protective measures, such as wearing a good quality, snug-fitting mask, avoiding crowding, and improving ventilation in indoor spaces. Thank you.
Merci beaucoup pour vos remarques. Donc, je vous rappelle qu'il y a...
Thank you for your remarks. As a reminder, we are here until 10:45. So we'll move right away to questions. Operator, over to you.
Merci, thank you. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. Our first question is from Abigail Biman from Global News. À vous la parole. Please go ahead.
Good morning. Thanks for taking my question. I'm wondering if you can talk about BA2, what we know about how many cases there are in Canada, what people should know about it, and how concerned you are.
Dr. Tam?
Thank you for the question. Yes, our National Microbiology Lab, together with provincial and territorial labs, have been tracking this particular sub-lineage, if you like, of Omicron. And we know that we've detected it since November of last year. We're one of the first countries to actually pick up on this variant as well. And we have at least over 100 identifications, 77 of them from the National Microbiology Lab, and some further reporting from provinces and territories as well. We're still learning, of course, about this subvariant. But at the moment, the international data suggests that it could potentially have an increased advantage on spread, but there doesn't seem to be any specific increase in hospitalizations or the severe outcomes compared to BA1. But we'll be tracking that very closely.
I'm wondering if you're concerned that having increased cases may extend the current wave that we're in, and if you could also provide context as to if we've seen it since November, is it picking up speed now, or is it of more concern now in January?
Well, we're still monitoring this very closely. The vast majority of our identifications are the BA1, but that doesn't mean BA2.2 couldn't pick up later on. There's always a possibility that could occur, but we don't actually know that yet. At the moment, it's really a BA1 Omicron wave. Other countries have observed, I think, different trends. Some have seen increases, but not very much. And other countries, such as Denmark, have seen a greater increase. And that could be due to a number of factors, including whether it got introduced into a particular pocket of underprotected populations. So all of that is still being worked out. As I've said, getting to perhaps the peak is one thing, but coming down the other side of the wave includes a lot of people who could get infected, and some of them could potentially be infected with BA.2.
Next question.
Thank you. Notre prochaine question est de Christian Noël.
Next question from Christian Noël from Radio-Canada. Good day, Mr. Duclos. The question is for you. It's on the trucker convoy approaching Ottawa. Can you tell me, what data do you have to show us that it is necessary to mandate for truckers to be vaccinated at the border? And if not, why have you not removed this measure? Thank you, Mr. Noël. I'll begin with a brief introduction to give you the overall portrait of the situation. We have repeated over the past weeks that that we need to always remain respectful and peaceful when protesting. People have the right to live in safety, which is just as important as rights of freedom. It's always important to remember that vaccines are not to punish people, they are to protect people. When we protect ourselves, we also are protecting ourselves and others around us from ending up in terrible physical condition, which could lead to hospitalization, even critical care, or death. So this is all in the context of, meaning, good faith, respect of others. So the threat is not vaccination. The threat is COVID-19. And if there is one tool that we should use to the utmost against this virus, it is vaccination. We're all in this together to get through COVID as quickly as possible, and it's when we use vaccination that we see the most progress in getting through this. Now, the Omicron variant has shown a certain resistance to vaccines, but vaccine effectiveness, especially the booster dose, has been shown over the past weeks. It will help us get through the crisis we're currently experiencing. There are almost 11,000 Canadians in hospitals currently across the country. This is the highest we've ever seen since the beginning of the pandemic. And everyone should protect themselves, but we also need to do so for our community. And we will continue to hammer this message home as a federal government to make sure that we all get through this crisis in a united way, and that means making use of vaccines and trying to have everyone vaccinated to the extent possible. Thank you. So I noticed that you did not have any data on the truckers being vaccinated. Now, I would like to talk about the end of lockdown. A number of provinces are planning to ease measures next week or in the next month, but you have talked about an underestimation of cases. So, some people think that the end to this lockdown is premature. Could you comment on that? Answer. Well, I will call on Drs. Tam and Yu to give us some epidemiological details. But what we have observed since the beginning of the pandemic is that prudence is not only the most responsible approach in the short term, but also the most responsible approach in the long term. A few months ago, for example, we all thought that we were out of the woods. We thought that COVID would become an endemic, but then we saw that we were mistaken, and a variant of COVID-19 came up. COVID surprised us again. And regarding the current situation, in terms of health measures across the country, I will hand it over to Dr. New. Dr. New, well, thank you for the question. Here's what I can add to what Minister Duclos has already noted. What we see with the Omicron variant is we're not really looking at the infection rate. We are really looking at the severe consequences, such as hospitalization and the strain placed on the healthcare system across Canada. There's significant strain currently. We might be past the peak, and we might be on the downward slope after Omicron, but as we've said this morning, a high number of cases are still possible even on that downward slope. So we need to keep an eye on what is going on the ground, and if public health measures start to be relaxed, including in allowing more contact between people, that must be done very prudently in all provinces and territories to keep infection rates down and to make sure that hospitalizations also are kept as low as possible. But we are optimistic, and there is reason for hope because it does seem that at the national level at least, we are past the peak. So now it is more a question of keeping an eye at the local level on what is going on epidemiologically speaking. And if the epidemiology allows, then yes, measures can be relaxed. As long as trends are showing that downward slope, particularly for hospitalizations and more serious effects on healthcare systems. Thank you.
Merci. Our next question is from Annie Bergeron-Oliver from CTV National News. Please go ahead. À vous la parole.
Thank you for taking my question. BC and Ontario have said that we need to learn to live with Omicron. In BC, they're now treating Omicron more like the common cold. Do you believe that this is the right approach, and is this what the federal government is now advising?
Dr. Tam?
Yes, I think it's a very difficult balance, but I think the provinces are trying to balance the overwhelming number of cases going on in the communities and the fact that you can't really do case and contact management similar to some of the other respiratory viruses. So focusing on more and more on having people stay home when they're sick and really heighten up their personal protective measures because it's very difficult for public health to do, individual case contact management. And so, and this, I think, was emphasized as being as the characteristics of this Omicron wave and how they're managing it. What we have to do is to take stock, I think, when we see this Omicron wave descend as to what may happen after the Omicron wave. And we are looking forward to gathering some more information, including from seroprevalence studies on the level of immunity in the population, for example, in order for us to get a better handle on what the next months will be like. But I'm certainly cautiously optimistic. As I've said, I think last week, but I think it would be great to be driven by a bit more data. I think that it's quite possible that the Omicron virus will continue to circulate, but will become more manageable. I think that's one of the indicators I'm looking for is whether the hospitals and ICUs and the health system is able to manage any kind of resurgence, and those would be the most important indicators. But I think all local and provincial health departments have a really difficult job trying to balance of course, the disruption in society versus managing the surges.
Thank you. And my follow-up question is for both Dr. Tam and Minister Duclos. Many of the people involved in the trucker convoy that's heading to Ottawa are openly anti-vaccine. Some are encouraging people to ignore mask mandates, and some are encouraging restaurants to ignore public health restrictions and to reopen early. I'm wondering, what do you believe is the potential impact of this messaging, and what does it say about the challenge now and moving forward around buy-in to public health advice and guidance?
I may start and then turn to Dr. Tam for links between the public messaging, the actions that people take individually, and the impact of those actions on our collective ability to exit from COVID-19. First, about the messaging. As I was saying in French just a moment ago, The convoy of which we should be speaking is a convoy of everyone being on board, knowing that the enemy is not vaccination, the enemy is COVID-19. And the best tool to fight this enemy is to be vaccinated. We have the fortune we have had the fortune on Earth, because of the great progress that science and scientists made just a few months ago. We have the great fortune of having a key tool in our toolbox to fight COVID-19, Omicron, not only in the short term, but in the longer term. We have the fortune in Canada of having immense access, universal access to vaccination. And we have more doses than we need now to vaccinate everyone with a booster dose. So we have this fortune in Canada. But with this fortune comes a collective responsibility. We know we're all tired. We know it's sometimes a bit difficult to be mindful of the importance of following public health measures and being vaccinated. Vaccination is something that takes some time and may disrupt the agenda of a person or a family for some time. But now it's the only tool for which we know that there is a definite benefit, not only in the short and in the longer term. So the convoy is a convoy that we need to be on in a peaceful, respectful manner, looking forward to exiting from the crisis because of vaccination, an individual measure to be protect each other, ourselves, but also a benevolent measure, a measure of unity to protect others, to protect other workers, to protect our supply chains, protect our economy, and to protect all of the many workers and businesses that are currently affected because of the lockdown and public health measures at the particular time. Dr. Tam?
Yes, I think it's throughout the pandemic, and certainly since the start of the vaccination program, it has been really important to address disinformation and using multiple means to do that, including debunking misinformation as rapidly as we can, and potentially doing pre-bunking, which is to prevent disinformation and misinformation before they even start. So I think that I'm particularly pleased yesterday, for example, when Science Up First, Children's Health Care Canada, and other experts as well came together to answer questions that parents have on kids' vaccination, for example. So providing experts they're out there to answer questions, very legitimate questions that people have about vaccines, and their safety in particular continues to be extremely important. And I think I want to emphasize that Canada does have one of the highest vaccination rates globally, and we certainly could boost our booster rates, but I just want to thank everybody, and including workers in the transportation sector who did roll up their sleeves and really get vaccinated. And for the small proportion of people who haven't got their vaccines, we do have to make sure they have access to vaccination programs, and also answer some very legitimate questions that may have, and continue to do so. And vaccinations are actually very important to maintain the business continuity of our critical infrastructures. Thank you.
Okay, we have time for one more question. Just a reminder to keep your answers short, please. Thank you. Merci.
Thank you. Our last question is from Mia Rabson from the Canadian Press. Please go ahead. À vous la parole.
Hi, yes, Dr. Tam, I'm wondering if you can explain why NACI advice did not go to all teenagers to get a booster shot, which is what the recommendation is in the United States.
Thank you for that question. And I also have Dr. Tunis on the line from the NACI Secretariat as needed. But of course, NACI has been very thoughtful throughout this pandemic in terms of weighing out the risks and benefits. And right now, this is the off-label recommendation for the use of boosters in the adolescent age group. So a booster dose for the 12 to 17-year-old without the medical or social risk factors is not recommended due to the generally low risk of severe severe COVID-19 outcomes in adolescents who've received a complete primary series. And so I think that's partly the reason, but certainly for those with the higher risk conditions and circumstances, it is something that can be offered. And NACI will monitor the evolving science. This is their recommendation right now. That doesn't mean it couldn't shift, but they will monitor the evolving evidence and update the guidance as needed. They're also going to be looking at advice on recommending the timing of booster doses following an actual SARS-CoV-2 infection. So that might also come into play in terms of the decision on additional doses.
And Dr. Tam, I can also add to that the committee is really underscoring also the importance of that primary series for all adolescents. So for those who have not yet been immunized, that would be an important action to take. And in general, we're seeing really good durability of the primary series, the first 2 doses, against even Omicron in Canada and also in other countries. So that's something that the committee is monitoring very closely, and we're working with provincial territorial surveillance partners to understand exactly what the risk of severe disease is in adolescents after the primary series. So far, the signals that we're seeing in general at the population level is that it is still holding up well. And as Dr. Tam mentioned, it's early days in this adolescent booster program. The evidence is just starting to come in from countries like Israel, who have already initiated a program. And while they are seeing some significant benefit, ascertaining exactly what that benefit will be is still hard to do at this point. So we'll learn more over time. And as we've seen with the pediatric recommendations for 5 to 11 this week that have evolved, and at this point, NACI is now strongly recommending that, there might be a point at which the program is extended more broadly, or it might be that for the majority of adolescents, there's actually not a need for a booster dose. So it's, I think, early days, but the committee is very actively monitoring the space.
Thank you. I'm wondering if, just a quick follow-up to that, if you can clarify when you say that the doses are holding up well, if you mean to infection or severe disease. But my actual second question, Dr. Tam, obviously there is a large number of protesters arriving in Ottawa this weekend regarding vaccinations, particularly mandates for truckers at the border. I'm wondering if you could explain what data and science was used to decide that a vaccine mandate at the border needed to be go further and not stop exempting certain people, including truckers, and what tracking we're doing to see what impact that mandate is actually having on both the spread of Omicron or COVID in general and on getting people vaccinated.
So,
did you want to go first, Matt?
Yeah, sure. I'll go first. Just to clarify, against severe disease. So the primary series continues to perform well. We're seeing in the 75 to 80% range of protection against severe disease from Omicron in Ontario, and that's very similar to what's being observed in other countries as well. And there does seem to be an incremental benefit of booster doses on top of that. But in the adolescent age group, we don't yet know what that incremental benefit would be. And it might be actually that the adolescents are protected very well and maybe are at that top end of that severe disease protection. And they continue to generally be at low risk of severe disease from infection overall. So you'll see a priority focus of NACI in their recommendations around severe disease, understanding that at this point, in the pandemic, that continues to be the priority objective, is trying to focus programs around minimizing severe disease. Infection is also always welcomed if we can prevent that, but it's not the emphasis of the program.
Yes, and on the border measures, of course, no layers of border measures are completely effective. I always think of the Swiss cheese analogy, where every slice of Swiss cheese have some holes, and then layering on those protections are some of the approaches at the border. And vaccination and the requirements has formed a very significant layer of our border strategy overall. And that's with the improved availability and the access to vaccinations. I think you've seen that the government has increased those vaccine requirements as time goes by, because we just know how effective vaccines are. We have not tracked specifically, we've been tracking, of course, positivity rates amongst vaccinated and unvaccinated individuals, but we don't sort of disaggregate that information in terms of whether someone is a transportation worker or not. So I can't give you that information.
And just a last word based on what we've just heard, which most of us had heard and had understood earlier. We're all on the same convoy to exit COVID-19. And we know that the best road to do that is the vaccination road. We understand now there is frustration around COVID-19, but we also know that the only way to exit COVID-19 is to get vaccinated.
Okay, and on these words, I'm told this is all the time we have. So this ends the press conference. Thank you very much for your
And we've been listening to federal public health officials in Ottawa giving a COVID-19 update, speaking about a number of things there. We heard from Dr. Theresa Tam that there are a number of indicators that suggest that new infections have peaked in this country, looking at a number of things, everything from test positivity to COVID in the wastewater. We also heard officials there, including the federal health minister, commenting on that convoy that is making its way to Ottawa to protest this weekend. The CBC's Janice McGregor has been listening in. She is live in Ottawa for us. So Janice, wondering what stood out to you there?
Yeah, let's divide this into kind of the public health stuff and the convoy stuff, because